The member for Denison.
Speaker, my question is to the Prime Minister. Prime Minister, the Commonwealth must intervene in the Tasmanian health system. Waiting times are the longest of any state. For example, 946 days for urgent gastro and liver appointments, and doctors tell me patients are dying while waiting for treatment. Moreover, bulk billing by GPs is in truth declining, and Ambulance Tasmania has the slowest response time of any state. No wonder the AMA has lost confidence, and the Royal Hobart Hospital Staff Association warns of a severe risk to patient safety over this winter. Prime Minister, considering the federal government spends billions of dollars on Tasmanian health, will you now order an urgent inquiry into this dangerous, costly and avoidable fiasco?
The Prime Minister has the call.
Well, thank you, Mr Speaker, and I thank the honourable member for his question. And the honourable member understands that Commonwealth funding to health services, hospitals and indeed to Medicare and PBS in every respect in Tasmania is at record levels. The honourable member would also understand that the Commonwealth has recently made a payment of $730 million in respect of the Mersey Hospital, so that will be transferred back to the ownership and responsibility of the state government. That is a very substantial payment to the Tasmanian government to enable that to be done and to secure the provision of that hospital services and other services in that part of Tasmania. I recognise the concerns the honourable member has, but I'd say to the honourable member that the provision of the substantial financial support the Commonwealth makes to Tasmania enables the state government to deliver for its part on the public hospital services for which it is responsible. Those are the Tasmanian government's constitutional responsibilities. The Commonwealth is playing its part, funding Tasmania appropriately, substantially and increasing at every turn.
The Prime Minister will just resume his seat for a second. The member for Denison on a point of order.
A point of order, Speaker, on relevance. The question goes to an inquiry into the spending of that money.
The Prime Minister has the call.
Thank you, Mr Speaker. Look, I understand the honourable member would like the Commonwealth to take responsibility for the provision of health in Tasmania. I can assure the honourable member the Commonwealth is not going to do that. We have a clear constitutional responsibility which we are honouring. There was, as you know, the Mersey Hospital was acquired by the Commonwealth Government 10 years ago. That has been brought to an end at considerable cost to the Commonwealth, $730 million payment to the state. The state has all of the constitutional and political authority to manage its hospital system, its health system appropriately. The Commonwealth is playing its part, generously and justly providing Tasmania with the funds to enable it to do so.
The member for Bowman.
Thanks.